most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course,
Brad,
Bob.
today we're going to talk about the absolute best treatment, in our opinion, that one could do for thoracic pain or a thoracic disc problem, thoracic herniated disc problem.
Right, yeah, we've been getting a number of comments, people asking
Which
for,
we like, by the way.
Yep.
We like requests.
Which, yeah, so we're going to satisfy our viewers and show them this video. It's going
Now, I think we can safely say, Brad, that thoracic pain is not that rare. I mean, we see a lot of that.
Sure.
But a thoracic disc problem is fairly rare.
Yeah, the majority
of
of herniated discs are going to happen at the lumbar spine or up in the neck.
So lumbar is the lower back. Thoracic is pretty much every level where there's a rib attached.
Sure,
right?
right. And so there's 12. And of course, the neck, and if you look at the mechanics of it, the reason why there are not so many disc problems from here to here is kind of self-explanatory once you think about it. You look at the disc, or the vertebra here, or the back here, it is supporting the whole trunk, the arms, and the head.
Yeah.
So there's a lot of stress, particularly with bending or with seated posture, and it's all focusing right down in here, usually at the lower lumbar.
And that's about where your body hinges too, isn't it,
Exactly.
Brad? So I hinge here, and that's where you're going to feel the pain then, is in there.
Because that's where all the stress is. It's a physics thing. There's a mechanical pressure and leverage. Here to here, you have the support of the rib cage and a lot of connective tissue, a lot of muscles that really take this section of the spine and support it. It's like a major back belt. You know, and you put a back belt on your muscles here and talk about core strength. Well, you don't need it here because you have the ribs doing all this for you. So that's why there's not so many herniated discs in the thoracic spine, but it does happen.
And the ones where I see it in, Brad, or the ones where I see with thoracic pain, are a lot of times when they have the habit of, like, when they're bending something, like they bend more from the mid-back, and you can see that's where it hinges, is right here in the mid-back instead of down here.
Right.
So they're like working at they do a job where they're working at a table, and they're like this all day long. And it's right, you can see where the stress point is going to be.
I think a good example, if you're working where you have a bend where you have to reach over and down to get some product out of on a repetitive basis.
And that's funny, because that's exactly one of the people I treated. They had to reach into a bin, and that's I could tell right away that's why it ended up being thoracic.
Exactly. But we're going to talk about and how to address pain in thoracic. Oh, bring them one more time, Bob.
Sure, come on back.
Come on back. Now, one thing I did want to mention is something that therapists refer to as radicular pain, or where the pain can refer to.
Sure.
Okay.
Good point.
In the back, the nerves in the back, actually from the spinal cord, the nerves come out and exit, and they go around. Actually, they pretty much follow the ribs to the front of the body. So if there's pain here, it's not uncommon for someone to say, boy, it's wrapping all the way around here, and sometimes there might be numbness or tingling up around the rib cage and up into the front. And when we hear those symptoms,
then we're thinking thoracic.
Yeah, we're thinking thoracic. We're thinking a pinched nerve somewhere in this area.
Not Jurassic.
Not
Jurassic Park.
Yeah.
Sometimes trouble with breathing too. When they breathe, they feel it, because the ribs are all attached to those nerves, and so.
Now, the other thing we should talk about is what other things can cause pain in this area that are not related to that disc. So you're not getting all concerned about it. Number one, the muscles can be getting spasmed and tightening from poor posture.
Right.
Okay. And once these muscles, don't you turn around, Bob? These muscles between here, they got the rhomboids, and when they can tighten up, and up in the upper traps, they can tighten up, and the pain can spread up and down. And a lot of that, I think, is due to posture, wouldn't you say, Bob?
And so these exercises will help that too.
Exactly.
Yeah, these are good no matter which issue you're dealing with.
Exactly.
So
the other thing is facet joints. That could cause a problem. And we're not going to get into the detail of that, but there's 2 facet joints at each vertebral level. So you got 12 vertebrae, you got 24 facet joints.
A lot of joints that can give you trouble.
Exactly.
So,
all right.
Of all the gin joints and all the, All right, should we start with the first exercise, Brad?
Yeah. So oftentimes we're thinking, we have on the title, we have a McKenzie reference.
Right. And
so we're gonna go right to that. Why don't you move, Bob, please?
You're gonna start?
Yeah, why not? First thing I would try if you're having pain in the thoracic spine is just laying down And if this feels better than standing up, that's a good sign.
Right.
Okay, you might lay there for a minute or two, and then you're just going to do a simple press up like this. And if the first time you press up, whoa, it kind of hurts.
So he's keeping his pelvis down.
Yep. And if you do these the first time, maybe it hurts a little bit more, and then you go down, it feels better. Well, then test it again. And if you find that with repetition, it starts to feel better, then you're going to keep working it. You're going to go a little higher if you can, and just listen to your body. And I wouldn't do more than 15 of them for sure. Usually it's 10, and give it a rest.
The other thing you're looking for, like Brad said, is if it's spreading out more, if it's spreading around that rib cage when you're doing these, stop.
Exactly.
You're looking for it to narrow up and even concentrate more.
Exactly.
So if it's starting to spread out, that's not what you're looking for. We're looking for the opposite. We're looking for it to centralize.
Right, and that again relates to directly to the McKenzie system.
Right.
Okay, now the other thing you can do, let's get a chair out, Bob.
Do you need the ball right away?
Not right away, but we will. Get a chair that does not go too high. If it goes to your neck level, then you definitely need to use the ball.
Right.
But typically a chair that goes right around the bottom of your shoulder blades, scapulas. Okay, and you're just gonna arch and extend over that. You can put your hands like this, and you're gonna work it, or you can go up like this. And the same thing, you're going to look for if the pain comes to the center and decreases, and all that happening, you can maybe get a little more range of motion with repetition. So if I do it once like this, and it kind of hurts a little bit, and I was like, well, it wasn't real bad, but then you do it again and again, and it starts hurting more towards the center of the back and feels a little bit better by the 4th and 5th one, then go up to 10. By the 10th one, if it feels better, pain is more towards the center of the back, then you're going to use that exercise every hour as long as you get the same response.
Most patients I see, Brad, if it's working, you can tell just by the look on their face, like, oh, it's a little better.
Right.
You know, I mean, they can sense that it's the right thing to do.
Exactly.
It's not getting worse, or it doesn't feel right.
Right.
You know?
Yep.
So
just listen to your body.
right.
Now,
This is a neat trick.
yeah, this is a nice little thing. It's the same concept of what we did, but you can kind of take the force and go to a certain spot on your back a little easier, and it's comfortable too. Get a ball that's a little soft, not one that's got a lot of air.
A couple bucks at Wally Mart or something like that, right?
And sometimes you get those really cheap ones, and they're too hard, so you got to get them a little bit softer. Throw them in your freezer or something of that nature. But these kickballs are really nice. Can you? I usually have to hold that there. Going to go right there, and then you're going to kind of experiment.
Yeah, you can move it up and down in different spots.
Exactly. A lot of times you'll find one spot where it feels better. You can get more stretch with less pain, and that's the spot where you're going to go, and you're going to hit and stretch back.
This is a great idea, by the way. This is just really a nice little technique to help get you that extension in a comfortable manner.
I wish I could say I thought of it, but I didn't. One of our PTAs, Mike, did. We have to give him the credit. And actually, what he was doing with it with one of his patients was, Bob, can you grab my shoulders and just pull back? Just give me a stretch back. And with this particular patient, she just felt much better. It was a really comfortable stretch. She was very happy to have someone do this to help her back pain out.
Yeah, this is a little bit of genius here.
Yeah, I'm impressed. Yeah, well, give Mike kudos when you see him next time. All right. Now we better go on to the next one. Rotation. Now this is a tricky one. This is something that it takes a little practice sometimes, or you might be liking to start right away. Sit down, not on a bed, but on a firm surface so that you're scooted back a little bit and your pelvis is down to the table.
Brad, would you say you're doing this if this didn't work?
Right.
Okay, so now
use those first.
Yeah, if these take away your pain, you don't need to do this one.
Right. Exactly. Good point.
Okay, but if you're still kind of stuck or it's not going any further, then let's go to this one.
All right. Good point, Bob.
Okay.
This is why we got to work together, because only one half of my brain is working. He picks up the other half.
I got the other half. Yeah.
Okay. So those don't work. You're going to do this a rotational technique, and first you're going to go rotate to the right. You're going to rotate.
Really
to the
important
left.
that you have excellent posture with this. You want to sit up as straight as possible, maybe even exaggerate a little bit.
The pain might limit you that you're working with, but do what you can. Now, if you go to the right, it goes not too bad. You go to the left and it locks up. Wow. Then what you're going to do is work to the right, do 10 rotations to the right as far as you can comfortably, and then go back to the left. Now, if after doing 10 to the right, going to the left feels better, then you're going to work more to the right.
Yeah, you want to move in a direction that it allows you to. You don't want pain. Sometimes I put my hands here too, Brad, by the way.
That's a good way to do it too.
Yeah, I mean, because then you really know what you're doing here, and you're not just kind of, I mean, it just gives you a pure rotation.
Yeah, that's a good point. It locks up the upper trunk.
So again, so I feel good this way, I'm going to work this way. If it feels good this way, I'm going to work this way. I'm not going to push into an area that hurts.
This is where it can get tricky, Bob. I think sometimes if you go into the direction it hurts and you go 2 or 3 times and it starts to feel better,
right,
and the pain starts to go towards the center back, then
you can go in that direction.
Can go that direction. So this gets a little tricky.
Experiment.
This is where a therapist that has some experience really helps you out. But we're gonna, show you the way we think.
Okay, so you do the rotation, and hopefully that's going to help solidify things and get things feeling better, and you'll be in good shape.
All right, and this really works into that problem that we've been working on again, Bob, that broken heart.
That's right.
I'm thinking maybe this could kind of translate into that.
Yeah, if we fix this, we fix the heart.
Right. It's all in the trunk, right in the core almost.
We're genius. All right, thanks for watching.